In this finite element model, the patient parametric left ventricle has been modeled as fluid structure interaction problem. The solid mechanics of the heart consists of two sources of stresses, the passive and active. The final stresses produced in the tissue are obtained adding the passive stresses and the active stresses. Passive stresses are a consequence of the structural properties of the cells and the connective tissues. We have used a model based on the recently available experimental investigation of Holzapfel. Boundary conditions for this model are prescribed inlet velocity at mitral valve, right tube, and outlet aortic valve, which was calculated as a consequence of heart muscle contraction. As a result, we can see blood pressure and velocity distribution during whole heart cycle. Cardiac contractility is regulated by changes in intracellular calcium concentration. Normal functions requires that calcium be sufficiently high in systole and low in diastole. Much of the calcium needed for contraction comes from the sarcoplasmic reticulum and is released by the process of calcium-induced calcium release. In the right part of the screen, we can see higher contraction, which is influenced by an Entresto drug getting from Musica software a long fiber of the heart muscle, where input calcium function was determined from O'Hara-Rudy model. Also resulting PV diagram on the right part of the screen shows higher volume fraction or ejection fraction, which is directly consequence of an Entresto drug therapy. With this SilicoFCM tool, we can test different influence of drug therapy as well as different mutations from patients' genetic testing. Different points on the PV diagrams correspond to different distribution of blood pressure and velocity for two different contraction functions.